Right now, if you got sick tomorrow, you know exactly what to do. Call a doctor, check a pharmacy, search your symptoms, maybe just wait it out with medicine from a shelf. You have an entire system built to catch you the moment your body fails. For most of human history, none of that existed. No hospitals, no prescriptions, no diagnosis. And yet humans didn't just randomly die the moment they got sick or hurt. They had a system too. It just didn't look anything like ours. Because treating illness is older than medicine as an institution, older than the written word, and older than the very idea of a doctor as a specific person with specific training. Long before anyone had a medical degree, humans were already doing something recognizable as medicine, and the evidence for it is written directly into ancient bones and teeth. In 1957, archaeologist Ralph Selecki uncovered a skeleton in Shannidar cave in Iraqi Kurdistan that shouldn't have existed. Known as Shannidar I, this Neanderthal man had suffered a crushing blow to the skull early in life, likely blinding one eye. His right forearm had been amputated at the elbow. He walked with a severe limp from a healed leg fracture, and a 2017 reanalysis of his ear canals found he was almost completely deaf. By every reasonable measure, this was a man who should have been picked off by a predator or starved within weeks in the brutal world of the Pleistocene. Instead, dental analysis shows he lived to somewhere between 35 and 45 years old, genuinely old for a Neanderthal. Researcher Eric Trinkus put it simply, the only way he survived that long was with consistent help from the people around him. Someone was feeding him, guiding him, protecting him for years with nothing resembling modern medicine. That was the system, not a hospital. A group of people who refused to let him die. So the question is, when someone actually got sick, not just injured, what did people reach for? Here's where it gets specific. Between 2012 and 2017, researchers analyzing fossilized dental plaque from 5 Neanderthals at El Sidern Cave in northern Spain, dated to between 47,000 and 50,600 years old, made a discovery that stunned even the scientists involved. One individual had a visible dental abscess and an intestinal parasite causing severe diarrhea. Trapped in his hardened plaque, researchers found DNA traces of poplar bark, which contains salicin, the same compound your body converts into salicylic acid, the active painkiller in aspirin. Layered right alongside it, they found penicillium, the natural mold that modern medicine would eventually isolate into penicillin, roughly 40,000 years before anyone officially discovered antibiotics. This wasn't an accident of diet. Other individuals from the same cave showed traces of chamomile and yarrow, plants with no real nutritional value but well-documented anti-inflammatory and pain-relieving properties. Researcher Alan Cooper summarized it bluntly. These people knew what they were doing. Here's why that matters. This wasn't trial and error luck. This was a working pharmacy, built entirely from observed plant knowledge, passed down accurately enough that a sick, suffering individual reached for the two most relevant compounds available in his environment, a painkiller and something that fought infection at the exact moment his body needed both. So what about injuries too severe to treat with plants alone? Bioarchaeologists studying skeletal remains across multiple Paleolithic and Neolithic sites have repeatedly found something that shouldn't be possible without deliberate care: major long bone fractures, the kind that would leave a person completely unable to walk, hunt, or feed themselves, healed cleanly and in correct alignment. A broken femur left completely untreated typically heals crooked, if it heals at all, and an immobilized person with no support usually dies of infection, dehydration, or starvation within days. Instead, researchers keep finding these severe fractures healed straight, meaning someone had to have set the bone, splinted or immobilized the limb, and then fed, hydrated, and protected that person for the weeks or months it took to mend. Each one of these skeletons is essentially a signed receipt for an entire care operation that left no other trace in the archaeological record. So if ancient humans could treat infection and pain, could they actually perform surgery? They could, and the proof is even more direct. At a 7,000-year-old burial site in Ensisheim, France, researchers led by Kurt Alt found a skull with 2 deliberately cut openings, a procedure called trepanation, the surgical removal of a section of bone from the skull. One of the openings had fully healed over with new bone growth, unmistakable evidence that this person survived the operation and lived on afterward. This wasn't an isolated case. More than 1,500 trepan skulls have since been found across nearly every inhabited continent, from Europe to Peru to China, and researchers comparing survival rates on these ancient skulls to skull surgeries performed as recently as the American Civil War found that, remarkably, the prehistoric patients often did better. No anesthesia, no sterilization as we understand it, and still, people were opening skulls and and watching patients walk away afterward. So here's the assumption most people carry into this topic, that without doctors, ancient humans facing illness or injury were essentially defenseless. That sickness in the deep past meant a fast, brutal death with nothing anyone could do about it. The evidence completely dismantles that picture. Shannidar 1 survived catastrophic, disabling injuries for years through organized social care. The Neanderthals at El Sidron were self-medicating with a working painkiller and a natural antibiotic tens of thousands of years before either was formally discovered. Healed fractures across multiple sites show broken bodies being set, splinted, and nursed back to function by people with no formal training at all. And by 7,000 years ago, humans were performing actual cranial surgery with survival rates that would embarrass 19th century battlefield medicine. There was no hospital, no pharmacy, no medical degree. But there was accumulated knowledge, careful observation, and a community that showed up for its sick and injured members, which functioned as medicine long before medicine had a name. That's the real reversal here. We assume medicine had to wait for institutions, for universities, and licensed professionals to actually start working. But the core ingredients of medicine, pain relief, infection control, wound care, surgical intervention, and long-term nursing were all already present, functioning, and demonstrably effective tens of thousands of years before the first hospital was ever built. So let's put the timeline together. Around 45,000 to 50,000 years ago, at Shannidar Cave in Iraq, a severely disabled Neanderthal man survived into old age purely through group care. In that same broad window, at El Sidron Cave in Spain, individuals were self-medicating with plant-based painkillers and natural antibiotic mold, while across other Paleolithic sites, badly broken bones were being set and healed under someone else's careful attention. And by around 7,000 years ago, at Ensisheim in France, humans were performing skull surgery precise enough for patients to heal and keep living afterward. You can still see that same original instinct today. Every time you bring soup to a sick friend, sit with someone through a fever, or simply show up because someone you know is struggling, even though you're not a doctor and can't actually fix what's wrong. It's why isolation makes any illness feel so much worse, and why simply having someone check in on you when you're unwell genuinely changes how you cope with it. Not just emotionally, but physically. That impulse to gather around the sick instead of leaving them isn't a modern kindness we invented. It's the oldest form of medicine humans ever had, and honestly, it might still be the most important one.